Hello, my name is Anca Pruette. This presentation is for the clinical pathophysiology class, and it is about heart failure. Heart failure is a very common disease in the United States. About 5 million people suffer from heart failure, and about 500,000 new cases are diagnosed each year in the U.S. About 1% of the people are 50 years old and older, and about 5% of those diagnosed are 75 years and older. African Americans experience heart failure twice as often as Caucasians. So, what is heart failure? Congestive heart failure, CHF, is a condition in which the heart is unable to pump blood throughout the body or is unable to prevent blood from backing up into the lungs and the rest of the body. Um, in heart failure, cardiac output becomes insufficient to meet metabolic needs of the body. Cardiac output is determined by the stroke volume and the heart rate. Stroke volume is determined by preload, afterload, and myocardial contractility. And I'm going to go over what each one of these terms means. Preload and afterload are factors that affect heart pump effectiveness. Preload represents the volume of blood in ventricles at the end of diastole, which is when the heart muscle relaxes. Depends on the venous return and also depends on the compliance. Afterload, on the other side, represents the force needed to eject the blood into the circulation, into the body. Um, Arterial blood pressure and pulmonary artery pressure are factors that will affect afterload. Also, valvular disease increases afterload. Another factor that, or a test used to measure if your heart pumps blood effectively is the ejection fraction. This can be determined during an echocardiogram and represents the percentage of blood within the chambers that is pumped out to the body with every heartbeat. An EF of 45 to 70% is considered normal. If the EF is higher than normal, this could indicate the presence of certain heart conditions such as hypertrophic cardiomyopathy, while on a low ejection fraction below 45%, this could indicate that the heart muscle is weakened and the heart is failing. Some of the main causes of heart failure, well, first of all, CHF, congestive heart failure, occurs over long period of time due to an underlying condition. Some of the main causes are hypertension, long-standing hypertension, and this is because when blood pressure is high, the heart has to work harder to pump the blood against the pressure that it has to overcome throughout the body. And over time, the heart muscle may become thicker to compensate for the extra work it must perform. Eventually, the heart muscle becomes either too stiff or too weak to pump blood effectively. Coronary artery disease is another factor that can cause heart failure. Faulty heart valves, that's because damaged valve, either due to a heart defect, coronary artery disease, or heart infection, would force the heart to work harder to keep blood flowing as it should. So over time, this extra work can weaken the heart muscle and lead to failure. Another cause is damage to the heart muscle itself, which is called cardiomyopathy. This can be due to infections, alcohol abuse, drug users such as harmful drugs, illegal drugs like cocaine, or some drugs used for chemotherapy can also induce heart failure. Also, genetic factors can cause heart failure. For example, hypertrophic cardiomyopathy is a condition of abnormally thick heart muscle, and another condition is dilated cardiomyopathy. This is where heart muscle is weak and the heart enlarges. So these two are genetic factors which unfortunately we have no control over. Another cause would be congenital heart defect. This is a defect you're born with. And if the heart itself or the chambers of the heart or the valves have not formed correctly or have not developed correctly, the healthy parts of the heart have to work harder to compensate and to circulate the blood throughout the body. Another cause is inflammation of the heart muscle, which is called myocarditis. It's most commonly caused by a virus and can lead to left-sided heart failure. Other diseases include diabetes, hyper and hypothyroidism, lung disease like emphysema. Heart arrhythmias are a very common cause of heart failure because abnormal heart rhythms can cause the heart to beat either too fast or too slow. If it beats too fast, it creates extra work for the heart. And on the other hand, if it beats too slow, it prevents the heart from getting enough blood out to the body and can also lead to failure. Causes also congestive heart failure. There's also acute heart failure. And causes include viruses that attack the heart muscle, severe infections, allergic reactions, blood clots in the lungs, the use of certain medications, or any illness that affects the whole body. So as an overview, the term itself, congestive, from congestive heart failure, comes from blood backing up into or congesting the liver, the abdomen, lower extremities, and the lungs, pretty much the organs and body parts that it backs up into. Not all heart failure is congestive. Somebody can have shortness of breath or weakness due to heart failure and not have any fluid building up. There are different types of heart failure. It can involve the left side of the heart, the right side of the heart, or both sides. Typically, heart failure begins with the left side, which the left ventricle, because that's the main pumping chamber of the heart. So let's start with the left-sided heart failure. This is when the left ventricle cannot adequately pump blood out of the left atrium to the body, or when one or more of the heart valves becomes leaky or stenotic. Blood can back up into the lungs, and this will eventually cause left-sided heart failure. And some of the symptoms, if the lungs become congested with fluid, also called pulmonary edema, this will cause difficulty breathing and interferes with the movement of oxygen from the lungs and into the bloodstream, which will cause fatigue. Also, cough and left-sided heart failure will produce a frothy, blood-tinged mucus. The patient with left-sided heart failure will have difficulty lying down. He or she will need to sleep with the head elevated to avoid shortness of breath. Overall fatigue, weakness, irregular or rapid pulse. The patient might wake up during the night due to shortness of breath, which is called paroxysmal nocturnal dyspnea. And also, there's going to be weight gain noted from fluid retention. Right-sided heart failure or right ventricular heart failure usually occurs as a result of left-sided failure. When the left ventricle fails, increased fluid pressure is transferred back through the lungs, ultimately damaging the heart's right side. When the right side loses pumping power, blood backs up in the body's venous system. This usually causes swelling in the legs and ankles. And some of the symptoms of right-sided heart failure, again, fatigue, weight gain, including abdominal girth, distended neck veins, hepatomegaly, and peripheral edema. Another term used when it comes to heart failure is cor pulmonale. This, or also right-sided heart failure, this is enlargement of the right ventricle that is due to pulmonary hypertension. So it's high blood pressure in the lungs, and that is usually caused by chronic lung disease. Some diagnostic studies that are helpful in diagnosing heart failure is a chest x-ray that could indicate size of the heart if it's enlarged. EKG, an enlarged heart or a damaged heart will show some EKG changes. Some lab studies, cardiac enzymes. BNP is a very good indicator, which is the beta natriuretic peptide. Electrolytes, potassium, magnesium, and ejection fraction. Also, the primary goal for diagnosing heart failure is to determine the underlying cause, what made the heart to fail. So a good history and physical is very important. Now, some therapies used in treating heart failure, drug therapy. ACE inhibitor is a first-line heart failure drug like lisinopril. ARBs, the angiotensin II receptor blockers like losartan, nitrates to help increase oxygen delivery to the heart muscle, beta blockers, and diuretics, of course, to get rid of the extra fluid. Management of the chronic heart failure, something that the patient can do at home, is the DASH diet, which is a dietary approach to stop hypertension. Definitely sodium restriction, usually less than 2 grams per day. Potassium is okay. Potassium supplements or foods that are rich in potassium, unless the patient is on a potassium-sparing diuretic like aldactone. Fluid restriction may or may not be required. This depends on the type of heart failure and depends if the patient presents with edema. Daily weight is very important. The patient is supposed to weigh at the same time every day, same clothing on, and also it's very important to keep a weight log. A weight gain of 3 pounds over 2 days or a 5-pound weight gain over a week has to be reported to the healthcare provider. And some invasive procedures for treating more severe chronic heart failures would be the intra-aortic balloon pump therapy. This will increase myocardial oxygen perfusion while also increasing cardiac output. The ventricular assist devices, they can partially or completely take over the pumping for the ventricles. It's also used as a bridge to patient that needs a transplant, and also as a bridge to recovery from either heart attack or heart surgery. Cardiomyoplasty, this is when a healthy muscle is wrapped around the heart to provide support, and the most common muscle is the latissimus dorsi. Ventricular reduction, which is really shaving of the ventricular wall in order to reduce the enlargement of the heart, and worst case where none of these interventions work for the patient anymore would be a transplant or artificial heart. Overall, with any disease, if it is discovered in time and the patient is interested and is willing to work with a healthcare team. Heart failure can be managed either with diet or medications, healthy lifestyle, or altogether.